J's Anatomy Hub, and today we are going to study the radius. So it is a long bone. Next is the location. Radius is the lateral bone of the forearm. Next we'll study the features of the radius. The radius has a head, it has a neck, a shaft and a lower end. Let's look at the head of the radius. The head of the radius, as you can see, has a concave surface that articulates with the capitulum of the humerus, and it has a circumference. The circumference also articulates as it fits in the socket of the radial notch of the ulna. This is the radial notch of the ulna. Next is the neck. The neck shows a radial tuberosity on its lower end on the medial side. Now moving forward to the shaft, we have three surfaces and three borders. So first, let's study the borders. This sharp border is the medial or interosseous border of the radius. This border that you can see upward points from the radial tuberosity, moving obliquely in the upper surface and then vertically in the lower area, ending towards the styloid process of the radius. This border is known as the anterior border. This is the anterior border. This is the medial or interosseous border. And if this is the anterior border, so moving laterally and behind this border, you can see that is really prominent in the middle is the posterior border. Now if you notice, this oblique line at the posterior border is known as posterior oblique line. और ये जो सामने की तरफ आपको oblique line नजर आती है, this is the anterior oblique line. Next we'll study the surfaces of the radius. So we have three surfaces: the anterior surface, the posterior surface and the lateral surface. Anterior surface वो surface है that is between the medial or also called interosseous border and the anterior border. This is the anterior surface. Next surface that we have is the lateral surface. This lateral surface is between the anterior border and the posterior border. Next, you can see another surface that is between the posterior border and the medial or interosseous border. This surface is known as posterior surface. Now, remember something about the anterior surface. The anterior surface पे the nutrient foramens open in the upper part and it's directed upward. Now let's move forward to the lower end, the widest part of the bone. It has five surfaces. This is the anterior surface. This is the lateral surface that prolongs downward. और ये क्या बनाता है? Styloid process. This surface, जिसमें आपको ये चार grooves नजर आ रहे हैं for extensor tendons, is the posterior surface. और इस posterior surface पे हैं dorsal tubercle of Lister. इसके अलावा ये ट्रायंगुलर से क्या नज़र आ रही है? मीडियल सरफेस. और इसको आइडेंटिफाई करने का और तरीका ये है कि ये आपका शार्प जो क्रेस्ट इंट्रोशियस बॉर्डर है, ये भी आपको इसी की सीट में नज़र आ रहा है. The fifth surface is the inferior surface. As you can see, inferior surface पे there is a triangular area and a quadrangular area. This medial quadrangular area is the facet for the lunate bone of the carpal bone, and another boat-shaped carpal bone is scaphoid. उसके लिए this triangular facet is present on the inferior surface. अब हम करते हैं side determination. So for the side determination, आपने सबसे पहले upper end को देखना है. At the upper end आपको एक disc-shaped head मिलेगा, जिसकी एक narrow neck होगी, और इस narrow neck के side पर आपको medially क्या मिलेगा? Radial tuberosity. Lower end पे आपको एक expanded सा part मिलेगा lower end का, जिसपे आपको laterally styloid process मिलेगा. Then lower end पे posteriorly जब आप देखेंगे तो आपको four grooves मिलेंगे, तो आपको ये आइडेंटिफाई हो जाएगा कि this is the posterior surface, और यहाँ पर आपको dorsal tubercle of Lister भी मिलेगा, और जो इसका sharpest border होगा वो medial border होगा. So that is how you'll know this is the medial border towards the ulna. This is radial tuberosity towards the ulna side. This is the anterior part. This is the posterior part. So this is the radius of the left side. Now the joints formed by this radius is capitulum के साथ upper end पे of humerus. ये क्या फॉर्म करती है? एल्बो जॉइंट. यहाँ पर ये हेड अल्ना के साथ आर्टिकुलेट करता है और आपको क्या देता है? सुपीरियर रेडियो अल्नर जॉइंट. उसके अलावा आपको लोअर एंड पर ये कार्पल बोन्स की वजह से ये पता चल रहा है कि आपको मिलता है रिस्ट जॉइंट, और इंफीरियरली आपको इंफीरियर रेडियो अल्नर जॉइंट भी मिलता है. सो दैट इज़ ऑल फॉर द रेडियस. थैंक यू.